Trends in pharmaceutical supply chains. Joining us to speak about that today, Jim Calabrese, Director of Supply Chain Systems at Sanofi Genzyme. Jim, welcome.
Thanks, Russell.
Well, Jim, let's start by talking about your particular organization there. And let's talk about its goals, its objectives, its aims in terms of supply chain management. What would you say?
So, Sanofi Genzyme is a company that manufactures drugs for a number of markets, number of products, rare disease products, multiple sclerosis, oncology, immunology products. We're a biotech company, and biotech has really long supply chains, long lead times, lots of regulatory issues, and those give us challenges, of course. And our challenges are often around making sure that supply, which is frequently variable, is aligned to our demand. Being able to do that in this regulatory environment where there's long lead times for approvals makes that difficult, and that's, a lot of our challenge.
I think it's fair to say there are an awful lot of changes going on in the pharmaceutical industry, a number of concerns, and clearly government regulation is driving a lot of that. You are going through a transformative stage there at Sanofi Genzyme. Well, let's talk about that. Let's talk about how that is impacting the supply chain, how you are meeting those challenges. What would you say?
Sure. So we traditionally, we started out as Genzyme many years ago in a rare disease, 50,000 patients in the world that have a disease. And we grew up as a biotech company. In 2011, we were purchased by Sanofi. And over that time period, we acclimated to Sanofi's processes to some extent. But Genzyme always had this end-to-end view of the supply chain, whereas Sanofi was much more plant-centric because their supply chains were a little easier than ours were. And that end-to-end supply chain idea has grown. And as Genzyme has matured as part of Sanofi, they've actually reorganized the organization, gave Genzyme more responsibilities. A couple of the drugs, the oncology area and the immunology area, are new. So our challenges within supply chain are to take those new products, integrate them into that end-to-end supply chain view, and we're using rapid response to help with that. And the first thing we're doing with these new products is to start to bring them up on an S&OP process. The S&OP process for us needs to be end-to-end because you're dealing with drug substance, drug product, finished goods. Again, very long lead times to do that. You need to plan out multiple years in order to get volumes up and capacity up. And those processes they're not plant-centric, they're end-to-end. And that's where the tool really does help us quite a bit.
Let's drill down into that just a little bit. Clearly there is this comprehensive, or as you say, end-to-end supply chain that you're dealing with, but you've taken a network approach to that. Well, let's talk about the benefits, if you will, that have flowed from that approach. What would you say they are?
So that network approach, we started out 6-7 years ago with no visibility across our supply chain in any one tool. Excel spreadsheets everywhere, right? So the tools that we're using today with rapid response allows us to bring that data together. So the first thing we got was visibility. Where is our inventory? Then we started with our demand processes, improving our forecasts. Our forecast accuracies increased quite a bit. That has driven a more stable finished goods plan. Started doing DRP planning with finished goods across 40 different market level distribution centers, 2 regional distribution centers, 3 finished good plants manufacturing that. And the ability to manage that within the tools that we have, it provides us with a lot more visibility to when we're going to be late. We can inform people ahead of time. And as we've started to go down further into the bills of material to do more planning, we're able to start to leverage capacity planning, attribute planning, and those are things that are on our list of things to get done pilots this year, full rollouts next year, in addition to bringing new products on to Sanofi and starting that whole process all over again.
Would it be fair to say that supply chain planning technology has helped Genzyme to revolutionize its supply chain? What would you say?
So revolution is to me, violent and quick. We've really approached it with an evolutionary process where our industry is often slow to move. It's one of the things about pharmaceuticals. It takes a long time to develop drugs, it takes a long time to get them approved, and I think people are not used to revolutionary change. So the process piece of it has lagged the technology piece of it, and that's one of our great challenges in terms of being able to implement revolutionary technology, is to get the people on board. We're trying new approaches in terms of change management to do that, but it's more evolutionary for us right now.
You're absolutely right in terms of characterizing your particular vertical as being a bit slower to move than certain others. Let's talk about the journey there at Genzyme, or at Sanofi Genzyme. Where is it going from here?
So as I mentioned, we've got some pilots in place right now. That was part of our road mapping strategy that we did. We actually used one of Kinaxis' partners. We used Barkawi to help us put a road mapping exercise together. And what that really did was help highlight, okay, you're spending a lot of money on this tool. Where can you leverage it better? Where aren't you leveraging it at all? You've already owned the licensing. What can you start using? So they put together a multi-year roadmap for us.
The tool you're talking about is rapid response.
Correct. But it's not just rapid response. It's also the processes that are behind it. Because again, the technology's there. If the processes, the business processes that need to back it up aren't in place, you're not going to get the change that you want. So that road mapping process, we did some data cleanup, we did some upgrade work, and then we started to do, again, capacity planning, lower level planning, inventory management and S&OP are next up on the list, and then kind of on the multi-year out, really integration with financials, integration with more demand planning, statistical planning, those kinds of things, and then optimization on the far outside of things. So that's where we're going. And as business priorities change, the roadmap will change. As we put that exercise together last summer of 2015, we weren't aware that we were taking on new products as Sanofi Genzyme. So as that's happened, we've reprioritized. But it still gives you kind of that, what are you shooting for? How do you align goals with the business in order to be able to make sure you have the resources in place? Because again, the process piece of this for us is harder than the technology piece. So really having that strategy ahead helps us articulate it out to senior management where we want to go, and then the people who are actually going to do the work for you, and working with the directors and managers that have to make the change possible.
Well, great overview into what's going on there. Best of luck as you move forward. Jim, I know you're busy here, but you found time to speak with us. Thank you very much.
Well, thank you.
That's Jim Kellerise, Sanofi Genzyme, speaking about supply chain management and the supply chain journey at Sanofi Genzyme. Thank you for watching.